So basically what we reviewed was what are the advantages that males have because they've had a lifelong exposure to testosterone. What advantages does that provide for them when it comes to athletic performance? So if you want to take a male from conception and very early on in embryogenesis, that baby is exposed to high levels of testosterone, and that sets them up for later in life. So first of all, it makes them have a male-like brain.
Mm-hmm.
It sets up their lungs, so males have more what we call alveoli. So these are little sacs in the lungs that take in the air and allow gas exchange. So this is all happening while the baby is in utero and being exposed to those androgens in utero. During the first year of life, we have another surge of androgen where it sets up things like heart structure, where the diaphragm sits. So in a female, it sits higher because she's going to have to carry a baby during pregnancy. And so that means her lung capacity is smaller than a male. We can't change that. And so other things like bone structure, which is different for male compared to female. And this is simply because females, again, have to birth a child, so they have a wider pelvis. So the angle from the pelvis to the knee is much wider for a female than a male. So if you have a wider angle, this is just simple basic physics, a wider angle means you can't generate as much force.
Right.
So if you're trying to lift something like a weightlifter, you're trying to jump like a long jumper, you don't get the force that a male can have. And then equally, for our elbow joints, again, because we females have to, when we swing our arms, if we didn't have a wider angle, because we've got a wider pelvis, we'd always be hitting ourselves. So we're born naturally with wider angles at our arms. So at our elbows, sorry. So again, we throw like a girl. We literally do throw like a girl because that angle is wider, can't generate enough force. So that's in any kind of throwing sport, javelin, if we're talking about athletics or baseball, these kind of sports. So males have an advantage. And this is before they hit puberty. And this is all because of the testosterone that was provided to them in utero.
So females, before they hit puberty, already have those wider hips and the elbows. That's not, or does it get exaggerated and
exaggerated in puberty? Because estradiol in females makes during puberty accentuates those bone growths and in a female
if you're
structure.
looking at the skeleton of a like an 8-year-old boy and an 8-year-old girl, you'd be able to tell which was the female because those physiological structures are already there.
Yep.
Okay.
Yep. Then as they go through puberty, testosterone rises in a male, stays high for their whole adult life, and then that's when we see massive increases in muscle mass and where the muscle is placed. So upper body muscle mass is much higher in a male than a female, and so they have 40 to 60% greater strength in the upper body and about 20 to 30% increase in their lower body mass and lower body strength. So again, because of testosterone leading muscle growth, they have that advantage. Bone growth, bone strength, all accentuated by that testosterone as they go through puberty, and also increases something called hemoglobin, which is what binds oxygen and carries it to the skeletal muscle. So they have a greater oxygen carrying capacity and they have greater lung surface area, so increased oxygen carrying capacity. And then the last thing is their heart. Their heart is a muscle. So a male's heart is affected by testosterone just the same as skeletal muscle and grows bigger. Bigger heart, bigger ventricles, bigger. So what does your heart do? It's a pump, and it pumps blood out. If you've got a bigger heart and can get more blood into your heart, you can pump more blood out when you're exercising. So this all just predetermines males to be better athletic performers than females. There's just nothing we can do about that. It's our physiology. And so if we look at world records, males do better
Yeah.
30%
We were just looking at
on strength sports.
The 100 metres, and I think the world record for females 10.71. And what was you saying, Bill? 9.58? Something like that.
Yeah.
So, and that might only sound like a second, but over 100 metres, that's a lot of distance.
It's a 10% difference between males and females for running kind of events, and for strength events, so weightlifting, those kind of events, it's up to 30%.
Right. So if a guy could lift 100, if a girl could lift 100 kilos, a guy could typically do 130.
Yeah.
That sort of thing.
Yeah.
And I was listening to a podcast the other day, and they said that there's some new research coming out at the moment that after 12 months of transitioning, both male to female or female to male, a lot of their strengths, etc., haven't changed by that much. Is that as you understand it?
Yeah, that's true. So if you lower your testosterone levels as in a trans female, remembering that the IOC, so the International Olympic Committee, only say that you have to lower your testosterone level to less than 10 nanomolar, which is still 10-fold higher than the average for a cis female. If you're sitting at around 8 or 9 nanomolar of testosterone and you're still training, it's not going to have it's not going to have much effect on your muscle mass at all. There's the memory effect of muscle, as well as the training effect on muscle, and the fact that you've still got some testosterone there to help keep that muscle mass there.
Yeah.
And we know that not just from trans females, or we know that from males that have prostate cancer. So if males have prostate cancer, one of the treatments that they go on to is called androgen deprivation therapy. So they lower their testosterone to they try and get it to zero, as low as they can. And that we know that if those patients train, if they go to the gym and train, they don't lose very much muscle mass over that whole 12-month period of treatment.